Week marked 5 years since the World Health Organization declared COVID-19 a pandemic. While health officials say most people now appear to recover fully from a COVID infection, some go on to develop symptoms long after the initial infection. Mandy Gaither has more on what we've learned about long COVID over the years.
It's characterized by symptoms that typically develop within 3 months after a COVID-19 infection and may last years. The World Health Organization says the chance of developing long COVID appears to be lower now than at the pandemic's peak, but with the virus still spreading, there's still risk.
Some people are still struggling with it today. About 30% of adults who had COVID have these persistent symptoms. That's what the data shows.
Common symptoms of long COVID include fatigue, breathlessness, muscle or joint pain, and sleep issues.
It does seem to be most correlated with how severe your infection was initially and your overall risk factors at the time of infection. So, for example, your age or your immune function.
Dr. Sanjay Gupta says for many people, long COVID can worsen conditions like lung disease, and up to 40% of those with long COVID appear to have persistent breathing problems, likely due to scarring or thickening of lung tissue from the initial COVID-19 infection.
Many people do seem to eventually recover, or at least improve. And while it may sound simple, doing directed breathing exercises, that can go a long way. And of course, doing everything you can to prevent another infection.
For Health Minute, I'm Mandy Gaither.
Dr. Gupta says staying up to date on both COVID and flu vaccinations can really help protect yourself against future infections. He says it's especially important for those over the age of 65 and those who are immunocompromised. Those groups are at a higher risk of getting severely sick.